Things are definitely much worse than the first wave. And I think that we try to be prepared mentally and within the hospital for a surge like this. But nothing really could have prepared for what we're seeing.
ICU nurses like Lindsay Burrell may seem like heroes to us, but they're still human. And this latest surge of coronavirus cases in Los Angeles is pushing the city's healthcare workers to a breaking point. We
are working in a complete battlefield where we're losing people 2 to 3 a day or during a shift. We're seeing the inhumane effects of what COVID does to people's bodies. We're seeing nurses just crumbling because we're exhausted physically and mentally. It's hard to stay hopeful when the deaths just keep climbing. The U.S. reported more than 4,000 COVID-19 deaths Thursday, the highest single-day total since the pandemic began, according to an NBC News tally. The state of California reported more than 600 lives lost on the same day. Over 200 of those reported in LA County alone.
Honestly, it's the first time in my nursing career that I feel that I don't have any control, or we don't have control, because it's not in our hands. At this point, it's all in the public's hands on whether they conform to the rules or they don't.
California is now the new New York. California is the New York that was back in April.
The absolute worst is when they verbalize it. When they say, hey, I'm not going to make it, am I? What do you say to that?
The only way that we're clearing beds right now to the intensive care is that if patients are dying. And when they are dying, they look nothing like they were when they came into our hospital. They're working 12, sometimes 18 hours straight. Oxygen is in short supply across LA County. And while hospitalizations here have dipped slightly, there were only 44 ICU beds available in a county of 10 million as of Wednesday. And only half of those are adult ICU beds. Lindsay fears fewer resources mean fewer recoveries. The amount of patients that are coming in the emergency department and then to the hospital and being admitted are tremendously higher. Then let's take it a step further. The number of patients that are requiring full support and eventually being intubated is 3-4 times what we were seeing before. This is much worse. Just 40 minutes away in Linwood, California, the situation is strikingly similar. Dr. James Simmons, a nurse practitioner on the front lines at St. Francis Hospital, says his COVID-19 patients are getting sicker and staying longer, too.
I have a 33-year-old who's been in the hospital now for almost a month. We cannot get him off of oxygen, and there's no oxygen in the county to send him home on. So he's actually occupying a room in the hospital right now because he needs oxygen.
Simmons recently reached a grim career milestone, treating a heart attack patient in the parking lot because there was nowhere else to go. Hospitals around LA County are using tents, hallways, even gift shops during the surge. But even if more bed space opens up, there isn't enough personnel to go around.
We can bring all the boats we want from San Diego to be medical facilities off the coast of Long Beach. We can turn the Staples Center into a hospital or the Convention Center into a hospital all we want. But if we don't have the people to staff those, it doesn't matter. And so it's an issue of both resources and of people.
And those staff shortages are delaying other non-essential but nonetheless important procedures. Dr. Tasha Dixon is a physician at Martin Luther King Community Hospital and Outpatient Center.
It really breaks my heart to not be able to provide the knee injections, and we're likely going to lose even more of our nurses to the hospital.
As bad as it is now, healthcare workers fear the worst is yet to come. The more contagious coronavirus variant that was first discovered in the UK is spreading across California. According to the Center for Infectious Disease Research and Policy, the CDC has identified at least 26 cases of this new strain in the state. And experts warn we haven't seen the full impact of the Christmas and New Year's surge yet. The psychological damage these healthcare professionals may endure is harder to measure. Experts worry the industry will see higher rates of anxiety, depression, and PTSD. And when the caretakers have no time or resources to care for themselves, they bring it home. There's not one death inside that intensive care or the hospital that we don't take home with us and really carry with us. We remember all of them. We remember their family members. We remember how they pass. These hugs, just what the doctor ordered to brighten yet another dark day. This is why I do it. I really want to show them what it's like to put your heart and soul into something, and despite how hard it is, truly loving what you do. And I love what I do. still love what you do?
I love what I do. If someone gave me $1 million to stop being a nurse to get away from this all, I would not take it. And I really mean that.
After months of doing his job from home and teaching health classes over Zoom, Chicago public school nurse Dennis Kosuth is expected back inside this building for the first phase of the district's reopening plan. But unless there's an emergency...
I've been working outside, so I've got 4 pairs of pants on. I've got these Sirius boots. These are Canadian boots. I got 2 hats on. I've got 2 gaiters. I got my mask on. And this is how I stay warm. Teachers at another school on the northwest side of the city did the same, despite being called inside last Monday, instead conducting their virtual learning outdoors to let the district know they don't approve of the reopening. December was the deadliest month in this country from coronavirus. People may have been traveling during winter break. I don't know where people have been. And we're gonna have kids come into school 7 days after that and think that this is gonna be just great. I mean, I don't think it's safe to have students in buildings right now. I don't think it's safe for staff to be in buildings. By Friday, Chicago public schools said about 65% of teachers and staff had reported back in person. The district says it's poured over $100 million into preparing school buildings for the return of over 77,000 pre-K through 8 and cluster group students who've opted for in-person learning. This includes a district-wide ventilation assessment, HEPA filters for each classroom in use, safety signage, and PPE bundles for the hundreds of schools reopening in the next month. But with COVID cases rising in Chicago and Illinois surpassing the 1 million case mark last week, teachers like Dennis say the risk of reopening is still not worth it. In a press conference Friday, the city's mayor, Lori Lightfoot, reaffirmed the decision to reopen.
I know you are anxious. I know many of you are scared. And I understand that. We are doing everything that we can to place safety in this pandemic at the front and center of what we are doing, and using the learning from other schools' experiences to our benefit, but importantly, to the benefit of our school community.
The city's positivity rate has remained around 10% in recent days. Bars and restaurants in the city are open for outdoor service only, but Chicago's parochial and some private schools have been offering in-person learning for months.
Many of these schools are in exactly the same neighborhoods as our CPS schools.
The CEO of Chicago Public Schools says reopening some schools now is a matter of equity, adding that teachers who don't show up to school this week for the students' return will be considered absent without leave.
When we look at student engagement with remote learning, we see huge gaps, in particular on the south and the west side of Chicago, which is predominantly African-American communities throughout the city.
Absolutely true, but who's actually signing up for in-person learning? It's the neighborhoods that are predominantly whiter, that tend to be more wealthy, that have opted to have their kids in schools.
The Chicago Teachers Union responded to the city's decision to push forward with the reopening in their own press conference.
The level of care that comes from the people who run this system, it really sucks. I'm trying not to be emotional. My 6-year-old nephew was the first person in my family to contract COVID. I've had 4 other family members since him, with 2 of them right now in ICU.
I mean, I appreciate doctors saying that kids need to be in school. My own kids need to be in school. I take the point. I would say to the doctors, they don't necessarily know what conditions are like in CPS buildings. There's a long history where we're told things will happen that don't happen.
One of the things music teacher Quentin Washington wants to see at his school is mandatory testing.
We need to have like professional sports type of testing where we're being tested regularly, and CPS's current policy is voluntary for staff, but that's not adequate.
Quentin is also worried that splitting classrooms in person and virtual will be even more detrimental than a fully remote system, especially for diverse learners.
That's unfair to the people that are on remote learning.
We heard from parents who had similar concerns and chose to keep their students at home, and others who were looking forward to their kids' return.